All right, how's it going? Dr. J here with another quick health message. And my health message today is you gotta invest in taking care of your spine. You have to take care of it. Think about it. Your spine houses and protects your central nerve system. What does your nerve system control? It is your master control system. That means it controls every single function in your body. Your nerve system is the foundation to everything that is you. That means that everything in your body is completely 100% dependent upon how well the nerve system is functioning. So, I mean, if we look over here at the spine, okay, you got all the nerves that come out. They go to all the organs in your body, and look how miraculous this nerve system is. I mean, it travels everywhere and it controls everything. So, I had a patient come in the other day, and she was having a slight bit of neck pain. She rated her neck pain at a 3 out of 10, but here's the problem. You can never base the degree of your problem on the symptoms alone. If I were to stub my toe, I would be in severe pain, but does that mean I have a severe problem? Not necessarily. And so she comes in and she barely has any neck pain, and here's the problem. Here's what her neck looked like. Okay, see where that red circle is? Okay, look at all that spinal degeneration. Yes, she has no disc spaces there. She has complete spinal degeneration there. She's actually in a phase 3 degeneration. Now, here's the thing. She tells me that she's got a 3 out of 10 as far as the level of her neck pain, and her neck pain comes and goes. Sometimes it's bad, sometimes it's not. Here's the problem with that. She's got all that degeneration. Well, as it turns out, she was diagnosed with a low-functioning thyroid. So here's the thing. Look at this picture again. Okay? The nerve supply that comes right out of this area, right out of C7, goes right into the thyroid. So do you think with all that degeneration and that choking on the nerves that are going to the thyroid, what would that do to the thyroid? Would it cause it to function at a higher capacity or a lesser capacity? Would it help it to function better or worse? Well, it's certainly going to function worse. So, number one, did the medical doctor, did he take any x-rays and look at her spine to see how her nerve system might be contributing to her poor thyroid function? No, he didn't. What he did was they did the blood panels. They found out she had a low-functioning thyroid, so they put her on her thyroid medications. So the thyroid medications are going to put out the fire, but the doctor never asked, okay, what is causing the problem? See, for every symptom, there has to be a cause, right? And so that's what we have to do. We have to dive layers deep and find out actually what's causing the problem versus just, treating the symptoms, right? So the doctor put out the fire with the drug, but he never looked for the cause of the problem. The second issue with this is she barely has any neck pain, right? But she has all this spinal degeneration going on. So she barely has any neck pain, but she's got all that spinal degeneration. And here's the thing. Your spine rotting away is like a decaying tooth, right? You don't even know that your tooth is decaying. You don't even know that you have a cavity. You don't even know that your tooth is rotting away until you get x-rays, and then they can discover that they have a cavity. So is it better to discover that you have a cavity with an x-ray, or just wait until you have severe pain? Okay? So if this particular person, okay, continues to get worse, it's going to continue to degenerate over time, what's life going to be like for her? What's her overall function going to be like for her body? Not very good. Okay, and I had a second patient come in. Okay, I don't know if you can see that. Okay, I'm very good at this. Second patient comes in, okay, 27 years old with a neck like that. She's got a complete reversal of the curve in her neck. Okay, in fact, she's got a kyphotic curve in her neck, and she doesn't have any neck pain whatsoever. But here's the problem. What's life going to be like for the 27-year-old if she doesn't get the problems taken care of with her spine now? So it's either now or later, right? So you might as well take care of the problems now. and she's barely getting any neck pain. So that's the thing I want you to understand. The only way to tell how bad your spine is with an x-ray. And that's why, you know, in my opinion, the best chiropractor to go to is a corrective care chiropractor, somebody who's going to take x-rays before and after a certain amount of care, somebody that focuses on actually correcting your spine, getting the pressure off your nerves, getting it to move better so that you can fully function and repair like you're meant to. So this is Dr. J signing off. We got a couple of cool workshops coming up. Number one, we got our Dinner with the Doc next Wednesday at 6:30, and we are also doing a workshop on how to get your energy back naturally, and that's the first Saturday of next month. So hope you have a great day and make it a healthy day, and remember, align to thrive.